The hot summer months are upon us again, and with that in mind, the Havasu Community Health Foundation is ready with ongoing programs to keep us healthy. This month, the foundation offered a seminar on skin cancer. Dr. Jonathan Ballou.
What they estimate is 1 in 5 Americans will develop a skin cancer in their lifetime. That's a lot. Anybody in this room has skin cancer diagnosed? Okay, how about anybody that's had a family member that they know of that has skin cancer? Okay. All right, so it's the most common form of cancer worldwide. So it's basically accounting for 40% of all cancer cases. So it's really a common thing. More than 3.5 million cases of non-melanoma skin cancer. We'll talk about the different types of skin cancer in a little bit, but non-melanoma skin cancer, which is mostly basal and squamous cell carcinomas, are diagnosed in more than 2 million people in the USA every year. So that's a pretty staggering stat. In 2005, they found that basal and squamous cell carcinomas are increasing in men and women under 40. So we talked about how it's an accumulating disease, but we're seeing it younger and younger patients. We're trying to figure out why that is. By 2017, it's estimated that 1 in 50 Americans will develop melanoma, which is the most dangerous skin cancer, and those are pretty bad stats right there. So the melanoma incidence rates, I'm going to kind of skip over this because we can't really see it. It's just a bunch of words and numbers, but basically melanoma is rising, and it's rising very quickly. Believe it or not, in females that are age 15 to 29, who you think could be very healthy, this is the fastest growing cancer in that age group in females. So we think it's due to tanning practices and the tanning beds and all these things that we think should be actually outlawed. A couple of states have actually done it, but UV damage that you get from these sun booths and these photo booths are really toxic. They can cause melanoma. So the survival rates. So people that have non-melanoma skin cancer, so basically not melanoma, basal and squamous cell carcinoma, are highly curable if they're detected early and treated appropriately. And we'll talk about the treatment at the end. The 5-year survival rate for people with melanoma, and it's detected early before it's gotten to the lymph nodes, is 98%. So if you find melanoma and it has not reached a lymph node, you have a 98% chance of curing it, which is a huge number. However, the 5-year survival rate for patients that have what's called a regional, meaning an area that's the first lymph node from where the skin cancer was found. So if you find it on the chest and it's found in the underarm, your 5-year survival rate drops to 63%. Just one lymph node. Okay, however, if it goes to beyond the lymph nodes into an organ, your survival rate is now 16%. So those numbers are pretty staggering, right? So if you catch it early, the key is you can cure 98% of melanoma. So that's really important. That's what the talk's about today. Mortality rates. 75% of skin cancer deaths are from melanoma. Only 25% are for basal or squamous cell, which is what most people get. But melanoma is super dangerous. 75% die from that. And those are patients that have melanoma. 1 American dies from melanoma every hour. In 2015, 9,940 deaths were attributed to melanoma, more in actually men than women. So there was twice as many. There was over 6,000 men and just over 3,000 women. So we're seeing it more often in men. And then the World Health Organization estimates that more than 65,000 people worldwide will die from melanoma. So it's not just an American problem, it's a worldwide problem. So what are the risk factors? How do you get skin cancer? We talked about at the beginning UV radiation. That's number 1. So exposure to both natural and artificial UV radiation. So artificial would be your tanning booths. Natural would be just going out to the lake, going out to the river. That's your natural UV radiation. That's number 1 as a risk factor. And it's an accumulation over time. Another risk factor is increasing intermittent sun exposure as a kid. So before age 18, what we're finding is that if you have a lot of sunburns, you're at a high risk. So as a kid, it's super important that you're telling your children, your grandchildren, they need to wear sunscreen. It's very important to stop sunburns before the age of 18. It's really important. Other things, we talked about the tanning beds, and skin that burns easily is a risk factor, as well as blonde or red hair. So if you're from a heritage that's Northern European, Scandinavia, Ireland, England, these are areas where the skin is really not used to getting a lot of sun, right, traditionally. These patients usually get more skin cancers because they're more at risk. They don't have melanin in their skin. Okay, so different types of skin. So actually everybody's skin is different. So when I see a patient in the office, I look at first I look at their hair color, secondly I look at their eye color, and then thirdly I look at their skin color. And so there's basically 6 different types. We call it the Fitzpatrick skin types. And number 1, you can see here, very white. This is more of a Northern European heritage. These are patients that burn right away, so they don't tan. You go outside and you burn right off the bat. That's a type 1, and that is the highest risk factor for skin cancer. As you go, and you can see this graph here, as you go towards a darker complexion, more an African heritage, you see less skin cancer. And evolutionarily, this was important because most of those people lived by the equator in Africa, where you had a lot of sun. So the skin adapted to prevent skin cancer. But if you lived at the northern latitudes, you don't get as much sun. It's overcast. It's not like it is in the equator area. They have more light skin. So our skin has actually adapted over time. So really important to know your skin type, and your doctor, your dermatologist should be able to tell you that. If you burn occasionally but you tan, you're probably a 2. If you always tan, you're a 3. If you're of more Mediterranean, Asian, Latin heritage, you're a 4. So when I look at a patient, I'm always looking first at the skin color, hair, eyes. That tells me a lot about their risk for skin cancer. Okay, so how do we detect it? Well, number 1, what you want to look for is you want to look for a change in size, shape, or color of lesion. So if you have a new lesion that comes up on your skin and you're concerned about it, it's bleeding, it's painful, it itches, get it checked out. It could be melanoma. Okay, so how do we classify skin cancer? Basically, there's 2 main types. There's melanoma, which is a really bad one. We talked about that, right? Then we have the not so bad ones, but they're still important. These are the non-melanoma skin cancers, basal and squamous cell carcinoma. Okay, here's a tanning bed. And if you guys can't see in the back, select a cancer, right? So from that list, basal cell, squamous cell, melanoma, right? So if you have any grandchildren or kids that do tan in a tanning bed, it's probably the worst thing they can do. I actually just treated a patient who's in her 50s, and she has a home photo booth and that she uses to tan. And she has a melanoma on her chest, and we ended up taking half of her chest skin off because the melanoma was so large. And she didn't really know how dangerous this was, and she had a beautiful tan, but now she's lost most of her chest because of the skin cancer. So really important to avoid these. I know none of you guys are doing tanning beds, but, right? Or maybe? But encourage your family members or friends to stay away from as well. Okay, so non-melanoma skin cancer. So we'll talk about that because that's more common, right? Not as dangerous, but much more common. So there's 2 main types. There's basal cell carcinoma and squamous cell carcinoma. So we'll take a look at these. What causes them? UV radiation, but there's other things. There's people that actually have a genetic defect where they cannot repair their DNA in their skin, and they get more skin cancers. These are people that get skin cancer in their teenage years, their 20s and 30s. So there are people out there that are more genetically susceptible. That runs in families usually. So basal cell. This is an interesting one. So basal cell has multiple different types. So you'll see there if you guys look inside, you'll see basal cell. That's only one type. And it's a classic type. It's what's called nodular basal cell. And you see basically a big dot, right? It's raised. It can be red. It can be irritated. But that's only one possible look to basal cell. So it has a lot of different looks to it. So nodular, this is the most common one. Not a very dangerous skin cancer, but if you leave it go, I've seen patients that have left it for 10, 15 years. It can destroy the skin of the face. And then it's a very dangerous thing. The incidence of metastasis from basal cell are less than 1%. So it's very, very low that it's going to go beyond the skin, but it can damage the skin. So if it's by the eye, if it's by the ear, if it's in the lips, these are areas where it can destroy the makeup of your face. So very important to get this one checked out. So let's look at some pictures. So this one is a lot like the one in your book there. You see here that it's basically this little raised lesion, okay? And it's got, what's interesting about these is they have these little blood vessels. You can see that little red blood vessel kind of coming through. It's called a capillary. And these are the most common ones. This is the one you would see if you're going to see one. You guys see all that? It just kind of looks like the same one you have in the book. Okay, here's another one. Looks very, very similar, right? So you got just some blood vessels coming out there, and it's a little raised lesion. It's on the face. Most commonly you find them in areas where it's sun exposed, okay? So it looks like a little nodule, right? See that over there? Okay. All right, next one. Superficial spreading. So this one is not in your book, but it looks very different. Almost looks like a rash. See that little plaque, little red plaque there? So this is often mistaken, even by primary care doctors, for a rash. They'll give you a cream, doesn't go away. So if you have one little spot and you're given a steroid cream and it doesn't go away, make sure you get it checked out. Usually what we have to do with these, we have to biopsy them because it can actually look like psoriasis. This can look like eczema. So it can look like a rash. So skin cancer doesn't have to look like a big nodule like that. It can look like a little rash. So be careful with these. Morphea-form basal cells. These are a little bit more aggressive. You don't need to know the subtypes, but basically this one looks a lot like nodular, but it's more subtle. You can see it's more flesh-colored. You might even miss it. This one's blown up really, really big, but when I see these in the office, they just look like regular skin, but if I shine a light on it, I can see a little bit of fluorescence. The area kind of sticks out to me. But if you were just going about your daily life, you may not even notice this. This is a dangerous one. Okay, this one's kind of interesting. This is a pigmented basal cell. Looks kind of weird, right? Looks like it could even be a melanoma. So with these cases, usually what we have to do is we have to biopsy them because this could be mistaken for a melanoma very easily. Much better prognosis than melanoma, though. So make sure it's biopsied.
Do you have that plug on your computer?
I don't. I wish I did. Unfortunately. Next time I'll bring one with a USB adapter. So, okay, next one. You guys have probably seen this. This is from Sun Damage. It's called actinic keratosis. You'll see an example in your little packet here. It is a precancer. It looks like it's on page 6. So this one is very, very common. Usually it's sun-exposed areas like your arms or your face, anywhere you've had a lot of sun, and it just looks like a little piece of scabbing, but it never goes away. So the key is, usually what happens is people tell me that, oh, I go in the shower, I've had this thing for like a year, and it just keeps coming off. Like it comes off, but then it comes right back. It never goes away. It just keeps scaling. It does that over and over and over. If that's what you see, got to get it checked out. This is the precursor to squamous cell, which is the second most common skin cancer, and they look very similar. So they start out like this. Okay, now when they're like this, I can actually freeze it with liquid nitrogen in the office, get rid of it. You don't need surgery for this. So it's really important to check these out when they're small. Here's another one. Now this gentleman looks like his arm or his hand here. You can see this little nodule. That's a precancer. That's a precancer. So with something like this, we can still freeze it. We don't have to cut it out, which is nice. Okay, so these are precancers. So here's an example of a gentleman's scalp. See all these little rough spots here? These are really common for guys. Because as we get older, we lose our hair, and what happens? We get sunburned. And that's where we get our skin cancers, is in our scalp, our ears. So for guys, it's really important that you check your scalp, have your beautician or your hairdresser make sure that they check around your hair, because these are really common in the scalp. And I've seen these go undiagnosed for years. They turn into squamous cell, and then we have to do surgery. So you want to get these early, and usually they feel like sandpaper. You run your hand across your scalp and you feel all these rough, scaly spots. They never go away. So it's important to make sure it's not this, because this is easy to treat here. Okay, this is actually a lower lip. This is a common thing that people get. They come in and they tell me, I have chapped lips all the time. I used to get a lot of sunburns on my lips, and now they've developed precancers of the lower lip. And believe it or not, this can turn into skin cancer called squamous cell, and then we have to cut it out. We have to cut into the lip. And if you've ever had anything done on your lips, hopefully you don't have to. It is probably one of the most sensitive areas in the body because there's a lot of nerves there. And so, it's not a very fun surgery to do for patients because it's very painful. And of course, you can't eat what you really want to. After the surgery, you have to, it's just a tough thing. So a lot of people don't know what to look for this, but if your lips are always chapped and it's not dry skin, got to get it checked out. Could be precancers, could be skin cancer. So important to recognize that. Squamous cell, second most common. This is actually a little bit more dangerous. So squamous cell carcinoma is the second most common skin cancer. It can metastasize, and the rates are anywhere from 4 to 12%. Usually it's on the face, the head, and the neck. We have a lot of lymph nodes. Cancer spreads by the lymph nodes. So lymph nodes are like your highway system for your body. Blood vessels, nutrients, they all go through the lymph nodes. So cancer uses the lymph node as a highway system to go to the rest of the body. So if squamous cells gets into a lymph node, it's very dangerous. It can actually be toxic, and people can die from metastatic squamous cell. So it's important to recognize this. So this is a blown up picture of a squamous cell. Look how close it looks to precancer, right? That stuff we were looking at before looks just like actinic keratosis. And sometimes when I'm in the office, I can't tell the difference between the two. I have to biopsy it because I don't want to miss this. Because if we miss this and we keep treating it as a precancer, it will, oh no, more trouble. I think actually the battery died. I think that's what happened. Okay, all right. Well, it's not going as smooth as I expected, but yeah. Well, I might have to just wing it from now. Let me just wing it for you guys. Okay, so, all right, so basically, so we talked about basal cell, we talked about squamous cell a little bit. Where do you get these? Mostly sun-exposed areas. So face, ears for guys, scalp for gentlemen, arms, legs. Okay, that's an area where you're going to get these. Melanoma, very, very different. Melanoma is dark. If you see, there's a picture in here that shows melanoma pretty nicely. We use an acronym called the ABCDEs. And each one of those letters stands for basically a different feature. So melanoma, if you guys take anything away from the lecture, it's recognized melanoma. So melanoma can either come from a new mole that you get out of nowhere, just pops up, or it's a mole that has changed. And these are kind of an illustration of the changes. What does A stand for? Asymmetry. So when I look at a mole, what I like to do is I like to cut the mole in half in my mind and see if it superimposes perfectly. It should match. So the right and the left side should be able to match perfectly. If I see that that mole is not perfectly circular, already has one feature that's bad. So it's asymmetrical. B is borders. So the borders should be nice and smooth. All these moles should have a nice, smooth, uniform border. Melanoma does not. Melanoma has a very jagged, irregular border. So that's a bad sign. C, probably the most important one, color. So when you see a mole that's changing and you see multiple colors, black, brown, tan, red, all within one mole, that could be an indication it's a melanoma. So be really on the lookout for color. D, diameter. So this one is a little bit more, there's a little bit more gray area. So they use a pencil eraser in there, which is around 6 millimeters. That's less than a centimeter. It's very, very small. But I've seen melanoma as small as 2 millimeters. So it doesn't have to always be 6 millimeters. But they kind of give that as an illustration of if you see the mole getting bigger, changing. The last one is a really important one too. It's called evolution. You can see that progression of that mole, where it starts out really small. It's nice and uniform. All of a sudden now it's making changes to the color, shape, and size. So that mole at the very end there you see on the evolution is a melanoma mole, and that can be very dangerous. So that's kind of what these look like. You're not expected to know what a melanoma looks like. All I want you guys to get from the lecture today is basically that if you see a changing spot, especially a dark spot on your skin, do not let it go. Come on in. We do skin cancer checks. We love doing them. I mean, that's one of the things we're happy to do. And I'm really happy when I can look at a patient and say, there's nothing that I see that's bad. We don't have to do anything. No freezing, no cutting. We'll see you next year, once a year. But I think everybody in this area, Mojave County, which is one of the places where you get more skin cancer per capita than anywhere else in the world except for the Australian outback, everyone should be getting a skin check at least once a year. If you have a skin cancer history, it's usually more. So if you have melanoma, we recommend every 3 months for 2 years after your melanoma diagnosis. If you have a history of melanoma that goes way back, I usually recommend twice a year. So that's the dangerous one. Okay, so how do you protect yourself from the sun, right? We live here. It's a great place. It's beautiful, right? You want to be outside, enjoy yourself. You can do that. I never tell patients, you got to stay inside. You can't go outside. You know, I've heard patients tell me that their doctors say, oh, you can never leave the house. You just got to stay inside. That's not realistic, right? So what you want to do is protect yourself. You want to know the danger times. They publish what's called a UV index, usually in the paper, or you'll see it, it's usually a rating from 0 to 9, and it tells you how much UV radiation you're going to get that day. And that can tell you, hey, it's going to be a really bad day. I need to avoid the really bad sun hours. What are those hours? 10 a.m. to 4 p.m. That's when you get the majority of your strong UV rays. So it's in the summertime and you have a UV index of 9. Not saying don't go out, but probably do your errands in the morning before 10, or later in the afternoon or at night. That might be better. So really pay attention to that UV index. Other things, sunscreen. So, there was an article a couple years ago about the safety of sunscreen. And I hear this all the time. People say, well, I'm not going to use sunscreen because it's dangerous. There's chemicals in there that can hurt you. Well, not really true. There's been no FDA-approved sunscreens that have shown any toxicity to humans. Okay? There was a mouse study that was done, I think about 5 years ago, on avobenzone, but that actually is proven to be incorrect. And there's never been one toxic case of use of sunscreen in a patient. However, if you don't use sunscreen, the studies show, yes, you are going to get skin cancer because you're not protected. So what are the good ones? Okay, make sure number one, it says broad spectrum. So what does broad spectrum mean? UVA, UVB, we talked about those, right? Broad spectrum blocks UVA and UVB. So that's important that it says broad spectrum. Number two, you want an SPF factor of 30 at least. So if it says 15 or your makeup has 20, it's like you're wearing nothing. Doesn't really work. So you want 30. You don't need 100. They're going to sell you their $90 100 SPF. You don't need that because it's the difference between the 30 and 100 is very, very minuscule. But 30 to 25, there's a huge difference. So it really drops off. So 30 is a key number. Okay, ingredients. What do you want? There's two main ones that I always look for. Number one, titanium dioxide. And number two, zinc oxide. Everyone's probably heard of zinc oxide. But the other one's titanium dioxide. Those two block UVB and UVA. So those are important that they're in your sunscreen. Doesn't matter the brand. You could use the generic no ad. Doesn't matter. Doesn't matter the brand at all. You just want to make sure it has those ingredients. The other thing is people put it on in the morning and they go out and they're going to spend all day at the lake and that's it. One time, titanium dioxide. Titanium dioxide, Dioxide. And the other one's zinc oxide, which is the traditional, white paste that you put on, right? Yeah. Yeah. So those are the main ingredients. So do you put it on once and then you're good for the day? No. You're actually supposed to apply it every 2 hours. It's kind of cumbersome. That's why I actually recommend clothing more so than sunscreen because you don't have to worry about reapplying, right? With sunscreen, you do. If you're wearing a nice cut-off shirt, you're showing off your muscles, guys, right? You're going to end up having to reapply that every 2 hours. So what you really want to do is, I wear long sleeves in the summer. It's 100 degrees. I buy the Under Armour and Nike make these dry fit material products that are fantastic, and the kids wear them too. And really encourage your grandkids and your children to wear these long sleeves in the summertime to the lake because sunscreen is just not feasible to do every 2 hours. You go in the water, if it says waterproof, you have to reapply it. You can't just put it on once and you're good. So it's kind of cumbersome to do the sunscreens. I recommend sunscreen, but clothing is so much better. Women, if you watch the Kentucky Derby, they have those nice wide brim hats. Those are like amazing for protection because they're going to cover your ears and they're going to cover, believe it or not, the back of your neck, which is a common area for skin cancer, and your face. So bring that fashion style to Lake Havasu, right? So that's important. For guys, if you work outdoors, I usually encourage my guys that work on pools or landscapers to wear wide brim hat, but then also have a tail that goes in the back that protects their neck. Because I can't tell you how many skin cancers I've seen on the back of the neck or the back of the ears, behind the ears too. So for guys, the ears, the scalp, the back of the neck is super important because we just don't have that protection from our hair. We just don't wear long hair. So that's just something that is important. So I'm going to kind of open it up to you guys. I'm sorry the presentation was kind of abbreviated. I had all these great pictures and all this good stuff to show you. Maybe next time when I come out, I can work on the UV, maybe some of the stuff before I get out here. But do you guys have any questions? I kind of want it to be interactive. Yeah.
With the long hair, the Beatles were right.
The Beatles were right. I tell you what, if you can pull that style off, I would say go for it. That's great. Yeah. Okay. So if you look on your handout on page 6, there's a beautiful example of a precancer. That's called a traditional precancer called an actinic keratosis. Okay, that is the precursor to squamous cell, which you'll see on page 3. And look how similar they look. The only difference with that picture, the actinic keratosis there is it's blown up, so it looks really big. But in reality, a lot of them are usually very small. They feel like little, they're just like a little lesion that's on your skin that's usually hard and it's raised. And those, if you leave them go, can turn into squamous cell. When they're small, we freeze them with liquid nitrogen. So, when you go into your doctor and they end up freezing those spots, those are traditional precancers. Now, moles, okay, which can turn into melanoma, there's some doctors that use the term precancer for moles. I don't use that term. I think it's kind of misleading. You either have a melanoma, which is a cancerous mole, or you have a normal mole. Now, you do have moles that are stuck. I think of it as a spectrum. So you got a normal mole here. Here's your time. Here's melanoma, okay? So that mole, when you're born, may have been programmed to change at a certain age. That could be influenced by sunburns, could be influenced by what you did for work. Did you work in a factory exposed to chemicals? And did you work outdoors and have UV radiation? So that mole can be accelerated towards a cancerous mole, which is melanoma. And there's these moles that I classify as what's called dysplastic or atypical moles, not precancer. I don't really use that term because not all of them will turn into melanoma, but they're stuck. And so when I see patients and I see a mole that's changing, not quite melanoma, not quite normal, I take it out because I don't want that progression to melanoma. So I don't really use the term precancer. I reserve that pretty much for actinic keratosis, which is precancerous. Does that clear it up a little bit? Okay.
For more information on cancer or any medical issue, contact the Havasu Health Foundation. Jim Matthews, Havasu Video News.